With the cold hitting this week, many of us are opting to stay indoors, but some here in Toronto are at the mercy of shelters. Shelters like this one here at Queen Anne Spadina. The city's shelter system has been under a cloud of criticism following what many here called a homeless crisis last year. But have things really changed this year? So, Darcy, when you go to a shelter, do you feel safe?
In my own world, but I know I'm not, because I've been a victim already of theft.
Safety concerns have been long-standing at city-run shelters, and we heard several stories in 2017 about unlivable conditions at facilities, including overcrowding, sickness, and barely working sinks and toilets. The city faced backlash over the conditions, and City Hall vowed to take steps to make improvements so some of the city's most vulnerable citizens aren't left out in the cold. The number of people served in emergency shelters has been rising for the last few years. The executive director of Haven Toronto, a drop-in center for homeless men over the age of 50, tells CityNews they saw a 10% increase in clients year over year who refused to use the shelter system, saying they feel unsafe, adding that he hasn't seen any improvements since last year. We reached out to the City of Toronto's Shelter Support and Housing Administration. They weren't available for an interview. When I asked them what changes the city has made since last year, I was provided with a link to their most recent winter plan. Amongst the changes mentioned, increasing space at shelters, including 9 new sites opening in January, and better technology for managing calls that should result in lower wait times and easier access to accommodations. A statement from the city reads in part, "We have improved our operational reliability and system oversight of the entire shelter system to address unexpected events that arise." The City of Toronto tracks data on those who experience homelessness, including the number of deaths on the streets and in city-run shelters. A significant number of these deaths are due to drug toxicity. Darcy, who has been living in a city shelter for 5 months, tells me he was almost part of this statistic.
Myself, I was a victim of an overdose on Christmas Eve. I wanted heroin, and they gave me fentanyl, and then I ended up in St. Mike's Hospital. Drug use is rampant in there, and you can get anything you want any time of day.
The opioid epidemic, and it is an epidemic in Toronto, the shelter's not immune from that. But it's information that we don't have access to. But we're continuing to hear about people using at shelters and people potentially dying from it.
Though the city tracks deaths at shelters, it doesn't provide the causes. Looking at the most recent numbers, in 2016 there were 30 deaths, an increase of 5 more the following year, and in 2018 there were 17, though the city website hasn't included details on the numbers from August to December. Haven Toronto says the city's data doesn't include their numbers and that of other community organizations that serve the homeless population. The drop-in center says it experiences 20 deaths at their drop-in annually, 6 by overdose in 2018.
Multiply that by all the agencies that are out here serving people. Again, it just gets to the simple fact there's no connectivity. None of this information is shared. There's no sort of proactive mechanisms in place for us to work with shelters, and shelters work with drop-in centers. So that would help.
And Darcy is a client at Haven Toronto, but the executive director tells me they didn't even know about his overdose at the shelter. He says there needs to be a better way where the city and like-minded organizations can have access to this information and share data.